Okay, so the next nerve which we'll talk about is the optic nerve or cranial nerve 2. Now this nerve is actually way too long, way too complicated to be discussed in a single lecture. So what I've done is I've divided this nerve into two separate lectures. One which will discuss about the basic anatomy of this nerve, and the second lecture will talk about the various lesions associated with this nerve. So basically what is going on over here is these are the eyeballs. This is a very crude representation. This is the eyeball, and this is basically the optic nerve itself, the little thing over here coming from over here. This thing which will basically the two nerves joining together is called the optic chiasm, which gives rise to the optic tract over here, and this optic tract ends up on the lateral geniculate body in the thalamus. This gives rise to something called the optic radiation, which then ends up on the optic cortex or the visual cortex in the brain, on the posterior aspect of the brain. Okay, so how does one perceive images? So basically what happens is this is actually the visual field. So what happens is the images actually get crossed over here, like the nasal aspect of the image will actually end up on the temporal aspect of the retina, and the temporal aspect of the image will actually end up on the nasal aspect of the retina. It becomes crossed or inverted. Same occurs for the other eyeball. So what we remember is any visual signal or any signal coming from one half of the body will actually end up on the other half of the brain. That's what we remember, right? So basically the nasal aspect of the image falling on the temporal aspect of the retina, or the this is actually the medial part of the image, or the what I can say is something coming from the right hand side. Okay, the image is falling from the right hand side like this, and this is actually falling from right hand side like this. So it has to end up on the brain, on the left hand side of the brain somewhere over here. So what happens is the nasal aspect of the image falls on the temporal aspect of the retina, and the fibers go like this, somewhat like this, traversal like this, go, and like this. Okay, and same thing over here. This image has to fall on the where this image has to fall on the temporal aspect of the retina, right this. So it goes like this. Okay, or the left hand side of the the other hand side of the brain. So it goes like this. Okay, so it converges on the lateral genital body over there. Clear? Same thing happens over here. If the image is actually coming from the left hand side of the body or the left hand side of the visual field, it ends up on the right hand side of the eyeball, and it has to end up on the other side of the brain. So it has to cross over like this, end up on the lateral geniculate body like this, and same thing over here, coming from the right hand side of the body like this, ends up on the lateral geniculate body like this. Okay, so this is actually the crossing over. This is actually the this is a very important concept to remember. This little visual uh, this optic chiasm, we'll talk about it in a lesion associated with the visual pathways. Now what happens to the neural pathways after they leave the lateral geniculate body? Now this retina is actually divided into two things: the upper half of the retina and the lower half of the retina. So the upper half of the retina, which perceives images coming from the bottom, actually goes like this. This is actually a very 2D image. It's actually 3D. It goes like this over the parietal lobe, like this on the parietal end, while the lower half of the retina goes like this in a horizontal projection, like this, crossing the temporal lobe. It makes a hairpin loop like this, which is very important. Again, over here, the upper half of the retina goes like this, like something which is coming out to the page like this over the parietal area, and this which is going in a horizontal trajectory like this on the lower half goes like this before they end up on the visual cortex. Okay, now we'll talk about the various lesions associated with this nerve in this next lecture.